Well, hello. Thanks for stopping by. It's your friend Christine. We're going to use what I've been trained to use. This is actually 2 decades old, but we're going to go for wrist and finger flexion and extension today. Now that my wonderful client is improving quickly, so they haven't used this setting yet. So I'm going to just describe it for you now. I'm going to turn it sideways. Someone gave me a nice hint to do that. So we're going to put 2 channel, let's see, sorry, this is ad lib as we go. So we're going to put 2 pads on the volar surface and 2 pads on the dorsal. So if you follow, we'll go over here to channel 1. So, oh, sorry, I'm upside down. Dorsal's here, so we're going to go right on that arm, and we're going to choose these size pads here just because we want to figure out the first time to get the motor units, which are the ones that kind of get the function going. So we're going to go 1 here, 1 here. So these muscles are extensor carpi ulnaris, radialis, longus and brevis, and then extensor digitorum, digiti minimi. So it would be probably more vertical with him,
like maybe
lengthwise, yeah.
Here?
That's about it. Yep. There you go. So we want to try to get the muscle bellies, right? There you go. And we'll do 1 down here. There we go. So it's a little different from the picture at first. We can always play around with this by using ultrasound gel and then putting the gel underneath the pad, and then you move it as the person goes to see where their motor unit is, because everybody has a different kind of setup sometimes after a stroke. This could also be used for people who have neck surgeries that affects their arm, any other neurological diagnosis that you notice your arm's not functioning the way you want it to. Of course, it's also combined with therapy. So yes, so the flexors are going to be carpi, radialis, and ulnaris. So it's about here, about there. Yep. And then the palm. So the flexor digitorum, superficialis, and profundus. It's about here. It's going to be on the carpal tunnel, so we don't want to provoke if anybody has any tingling or numbness. Just let them know this shouldn't provoke more symptoms. It should make it so the body's okay. We're going to go here and go alternate. We don't want to go constant on this, or we don't want to do all of 4 together, because then you're not going to be able to grasp and release like you want.
Yeah.
I haven't done that yet to change the modes, and it's not on, sorry.
So I'll show you here how to do this.
That's great.
Thanks. Okay. There we go. Whoop. Okay. So what we're going to do is go mode alternate right there. And then we'll just keep the settings. So I'll show the camera just so you know. The 47 seconds on, and then we have an off 47 seconds, 150 microseconds, 30 total, 6 ramp to go up, and then we're set. I think the hertz didn't show up, but that's 70. So from here, just know when you turn them on, they're going to go alternate. So when you start, so if you want to go ahead and start that, it should have wrist extension and finger extension on one, and wrist flexion and finger flexion on the other. So I'm going to go ahead and get that bolster back out for the forearm. Okay. And then I'll put a pillowcase on it for cleanliness. Okay. There we go. We're keeping the faces out of this so it's anonymous. There we go. And then I have a cone because the goal here is I want to hold my coffee cup and my hand won't do that, or be able to grip. There we go. So you're going to move it. Sorry, I'm distracting, but so now you notice when you turn it on what muscles are going by what vibrations you have. So, you know, the first thing is the first few rotations to get the movement in, and then go for the function. Does it feel like your wrist wants to come up? Okay. So I'm gonna maybe have you pause it. You wanna do it? We just can't show the face. Yes. So I'm going to turn this back off so I don't zing myself.
Smart.
And then I'm going to move this proximal.
Okay.
Okay, because the motor units, meaning the place that kind of gets the movement going, is generally at a little bit of an angle, even though the pictures on that first handout don't show it. Here. So we're going to just try that one. Go ahead and turn that one on again and see what it lets you do. There we go. Much better. Better, better, better. So that just that little bit of difference matters.
All the way up.
Okay, do you want a higher feeling to this, or is this
For now, let's leave it.
you're good? Okay. So that's part of why we did these big pads, is he had to go all the way up to get these fingers to move. But there's no pain. Yeah, there you go. Look at that.
Yeah, I can do that.
Okay. So from here, this is the next part, when it goes off for this one, it's going to release and grab. When it goes off for the bottom one, it's going to open. Okay, so you're wanting to hold this when the top one's off. Yes, so that you can grasp. And then when it goes, this part goes on, drop it. Okay? Does that make sense?
Yeah.
Okay. All right, so keep doing your good work. You can do this once or twice a day. For those of you who don't have this function, try it on the other side to help your brain. Okay? All right. See you next time. Bye.